Remember what sodium does? Increases your blood pressure, it's an osmotic. It pulls in water into the blood vessel, increases the volume of blood within your blood vessel by increasing water, and that's how the pressure rises. So your heart has to pump against more pressure. So that was the first step, which is to reduce sodium and also follow a DASH style diet to reduce blood pressure, to reduce the risk of a stroke.
Doctor, I will ask, I understand there are some people, I don't know how many percent, who are not affected by salt intake. Is that true? And then if that's the case, is it better for them just to limit salt too? That's my question. Thank you.
That's a really good question. It really comes down to your blood pressure. Last time I checked my blood pressure, and I can tell you I don't take any medication at all, my blood pressure was 96 by 55. And some people would panic thinking that's low blood pressure. I mean, generally the more fit you are, the lower your blood pressure. So it's probably more the fact that I play singles tennis with my 17-year-old son. We're at least 3 times a week. We're completely drenched in sweat by the time we're done. And it's the cardiovascular health which is leading to low blood pressure of 96 by something like 55. And so I can tell you, I'm not particularly worried about my sodium intake, simply because I know that my blood pressure is quite low. And apart from raising your blood pressure, sodium doesn't have any other major detriment to your health. Saying that, in our house we use potassium chloride. So we use salt substitute instead of table salt. That could also explain why my blood pressure is so low. And of course I do eat a lot of fruits and vegetables. Usually anytime I'm feeling hungry, instead of getting salted peanuts or something which would contain a lot of salt, I usually grab some oranges or something like that. So I'm not particularly worried about sodium if I do go out. So the answer to the question would be, the proof is in the pudding. If you have even borderline blood pressure, you should be very vigilant about your sodium intake. But if you have low blood pressure, then you don't have to be particularly vigilant.
Is Bell palsy considered as a mini stroke?
Bell's palsy is caused by a viral infection of a certain nerve in your face, which causes Bell's palsy. So no, that's not a mini stroke. Saying that, it can look very similar to a mini stroke. The way we can tell between Bell's palsy and not having Bell's palsy is whether your forehead is affected. So the doctor will ask you to pull your eyebrows up and check if your forehead is affected. So the first thing to be very mindful of was sodium intake and also following a DASH diet to reduce the blood pressure, because the biggest risk factor for having a stroke is high blood pressure. Let's move on to the next. As we discussed before, LDL cholesterol is very strongly connected with having heart attack, but it's also connected with the risk of a stroke. Ultimately, blockages within blood vessels can cause a stroke. They can also cause a heart attack.